The chairman of the Nigerian Medical Association, Dr. Ayogo Malachi Emeka, has emphasized the importance of proper remuneration and how poor pay affects the productivity of doctors and medical staff across Nigeria. This emphatic pronouncement was delivered during the celebration of 2024 Annual Fiscal Week, which was held on Tuesday, October 29th in Abuja. It was a fitting and apt comment in the spirit of the year's theme, ensuring universal applicability in remuneration.
The theme of this year's scientific conference, which is ensuring universal applicability in remuneration, a panacea to talent retention in healthcare industry, aptly resonates profoundly. Its implications on healthcare delivery in our nation are far-reaching. This timely theme emphasizes the imperative of equitable compensation, ensuring healthcare access, fairness, and inclusivity, competitive salaries, and quality patient care, ultimately stemming brain drain.
Giving support to the school of thought, the newly nominated Minister of State for Humanitarian Affairs, Tanko Sanunu, who spoke at the event, said the federal government's available salary scheme used to pay doctors in Nigeria needs to be reviewed.
For the common man to know, you understand? You see, where doctors have been paid in the country by a salary structure called COMMES, Consolidated Medical Salary Scale. But as today, it's not in all. The COMMES has undergo a lot of review over time. And this is not being uniformly applied in all the states of the Federation, including the level of local government. And they're thinking that if you want more talent to stay and work in Nigeria, you must make that remuneration to be equal for everybody. Because what we are seeing now, we have major internal migration. Doctors who are working with local government, because of that disparity, they move to the state. Those who are working with state, as soon as medical center or teaching hospital is also approved for a particular state, they move to that level. And others may go out of the country. And we have mentioned figures that were lost. So what our doctors are now saying in this year's Physicians Week, which is a week to celebrate performance of doctors and also to see what doctors can do for the general society as a means of social corporate responsibility, to say that, look, you have cooperated with us, you trusted your life for us in the last 1 year, and we're also ready here now to give it back to you. You understand? That's why we celebrate the Physicians Week. And out of that, our doctors are also worried that a lot of people are going out. And by their findings, what is most important is that the disparity in salary is making people to migrate, both internal and external. And we have just looked at the ways we can go far to ensure that we have that universal applicability. As a member of Federal Executive Council, I also try as much as possible to salute and thank the doctors for deciding to stay and work together.
At the event, a core discussion on the program was advocacy for breast cancer preventive measures to slow the risks of the spread. Guest speakers from African Medical Center of Excellence in Abuja also spoke on the state of breast cancer awareness in Abuja.
I think there are a couple of key things that need to be addressed, and without even getting into lifestyle issues and diet and that sort of thing, the best thing that we can do for breast cancer, and any cancer for that matter, is education for the public about cancer and breast cancer, as well as screenings. The sooner that we catch the cancer, the smaller it is, the easier it is to treat. Great example, in the US, where I'm from, you'll have about an 82% chance of survival of breast cancer. When you come to Nigeria, that drops to 50%. And it's all about outreach, it's about early screenings, and it's about treatment.
Have seen patients present very late to hospital because when they felt the early signs of the tumor, like a breast lump, or they have discharge from their breast or breast pain, they did not go to hospital. And you can't make a diagnosis of breast cancer if a tissue sample is not taken. So usually when they have these symptoms, they should go to a hospital, and then the doctor would ask that the lesion should be removed. Because some people don't want to have surgery, they will say no, and this is one of the reasons why there's delay in diagnosis. Cancer has 4 stages. If a patient presents in the first and second stage, the probability of treating the patient and getting cure is higher than if they come in the late stages, which is stage 3 and 4. Unfortunately, in this environment, because of delay in presentation, many patients come in the late stages.
It is notable that between 15,000 and 16,000 doctors have departed in the past 5 years, according to Nigeria's Health Minister, Mohammed Ali Pate. Today, Africa's most populous country has just 55,000 doctors for a population of 220 million.